What is up, y'all? This is Not a Real Doc DPT, and no, I'm not a real doctor, but I am a licensed and practicing doctor of physical therapy. And today we're going to be talking about what you need to know now after your total hip replacement. So, if you watch this video, the before video, then you should know that you probably are not experiencing a ton of pain right now. That is one of the benefits of this particular type of surgery, is that patients generally tend to tolerate it without a ton of pain. You might have a little bit, but it's generally not terrible and um, usually tolerated pretty well by patients. So let's talk about some of the things that you're going to want to be thinking about. So, as far as pain goes, if you are experiencing some pain, of course, you're going to want to talk to your, or excuse me, you're going to want to take your pain medicine as prescribed. Your surgeon understands that there might be some pain involved with this, so he's going to give you, or he or she is going to give you the appropriate pain medicines that you need. So, do recommend that you take uh, pain medicine if it is something that is bothering you. You probably are going to want to start with it just for the first day or two, just taking it, and then just kind of moderate it after that, depending on how things are going. Um, you're also should have been told by now whether or not you have anterior hip precautions or posterior hip precautions. If you have anterior hip precautions, then it's primarily you're not going to want to extend, you're not going to want to kick back with the leg that had the surgery. That means also that you're not going to want to take really super long steps. You want to keep your step length kind of close together. If you had a uh, posterior hip precaution, then you're not going to want to bend forward. So you're not going to want to break 90 degrees. You're not going to want to pick something up from the floor. Let's say you're not going to want to cross your legs over midline. And you're not going to want to turn your foot to the inside. You're not going to want to let your hip rotate in. So those are generally the posterior hip precautions. Um, within but you're going to want to follow, or let me say, you're going to want to know what precautions you have, and so that's going to come from the surgeon, and then your physical therapist should be able to answer those questions as well, if you're unsure what it is that you have going. But you're going to want to get that information from your surgeon. You are going to want to be on the lookout for two potential things that can be complications after orthopedic surgeries. They are rare, they don't happen a lot, but they can happen. I have seen this happen with patients. Number one is going to be an infection. So, signs and symptoms of infection is going to be, well, two sort of different things. One, and really the one that the surgeon is most looking for, is your dressing looks like it has just a ton of drainage on it. So if it looks like your dressing is just sopping wet and is just about to come off because it's so full with drainage, that is potentially a sign of an infection, and you're going to want to take yourself to the emergency room to have that looked at. You also, with infections, you might have increased redness that's local to the incision, increased swelling local to the incision site, maybe increased heat along that incision site area. All those things are going to lead you to want to go to an emergency room to check that out. A second thing that is a potential complication after this type of an orthopedic surgery is a potential for a blood clot. So, blood clots, you would be thinking about that for the entire leg of the surgical side. Signs of a blood clot are going to be increased redness, increased heat, and increased swelling along the entire leg compared to your leg that's not had surgery. Um, if you see all those things traveling together, you're going to want to check yourself by giving your surgeon a call, and as I say, probably going to the emergency room to get that looked at. Also, sometimes blood clots can present as just pain. So, like, let's say you just started having pain in your calf that didn't seem to go away, it didn't seem to get better, didn't seem to get worse. You seem to just always have this new pain in the calf. Um, you probably are going to want to get that looked at as well. I actually had that happen recently where I had a patient that was experiencing that and wound up sending her to the hospital, and turned out that she had multiple blood clots in her leg for that. So that's something that you would want to get looked at as well. So those two types of things, or two types of complications, can happen after these surgeries. They're rare. You don't encounter them a ton, but they can and they do happen at times. Um, Also, after the surgery, if you're not going to want to get that the dressing that is covering your incision wet. So that dressing is usually going to be in place for 2 weeks. Then the physical therapist will take it off. As I say, that the closings that surgeons are using a lot of times now are just surgical adhesives. So you don't necessarily have to be concerned about the physical therapist removing staples for this. However, if staples are called for to be removed at that 14-day point, then the physical therapist oftentimes will be the one to do that. That's assuming that the surgeon orders that. If they did not, then the surgeon will remove any staples that are there when you return to their office at that 2 week follow up. Um, the but you're not going to want to get that dressing wet. So if while it's intact, you're that dressing is going to be water resistant, but it's not necessarily waterproof. And I may have said those backwards, but basically that you can get a little bit of water hitting onto that dressing, but you don't want to soak it. So there's no getting into a pool, no getting into a bathtub, definitely no soaking in a hot tub. The heat is not going to help with that. It'll bring more inflammation into the area with that increased blood flow. But you are going to want to take a shower, and hopefully or preferably you'll have like a wand, and so then you can kind of direct where the stream goes. But usually we'll tell patients, just to keep the side where the surgery was, or that hip, turned away, keep the dressing turned away from where the stream is, so that way you don't have water just soaking that area. Usually surgeons now are also recommending that patients put on like press and seal, or sometimes we would even recommend putting on saran wrap, or wrapping around that area, just to try to keep the dressing itself from getting too soaked or anything. But as I say, the physical therapist will typically take the dressing off, and usually after that point, it's usually you leave it open to air, and that's typically how the hips will go. That's if the physical therapist is taking it off. If not, as I say, that will happen at the surgeon's office. Um, you're going to want to be using your walker. So the most important thing after you come out of an orthopedic surgery like this is safety. So no falls. So using your walker for 100% of your walking for about 2 to 3 weeks. Usually the surgeon, a lot of times the surgeon will defer to say, hey, 3 weeks and no questions asked, you're going to be on a walker. Um, Reason for that is you're much safer moving around. The chance that you might trip on something is lessened significantly when you're having a walker there. Also, something else is you're not going to have quite a you or you might not have, or you shouldn't have, maybe quite as much pain as you otherwise might if you're using your walker, because you're letting your arms take off some of the work, and they're by supporting some of your body weight. So your arms are actually helping your leg that was operated on from working quite as hard, because you're distributing your body weight across your arms and the walker as well. So it just helps your leg just not have to work quite so much. Um, Another thing is you are going to want to uh, follow all of the exercises that your physical therapist has given to you, and primarily for walking. If you watch the video that I did about before having your hip replacement, for four surgeries that of this type, of having a hip replacement, walking is the number one thing that you're going to be doing. It's really the number one thing that you can do for yourself. There are other exercises that we'll include that are important as well, don't get me wrong, but walking actually helps you to facilitate um, the bone growth. It helps your uh, body to just accept the component parts that the surgeon installed. It helps for scar tissue to line up and appropriately so that you are still functional with that hip. And so walking, I would generally recommend for patients generally about every 30 minutes to an hour, getting up and walking and moving around with their walker for 100% of all walking. That's what, that's really is the name of the game. You sitting for long periods, you're not going to want to do because your hip is going to stiffen up and then it's not going to feel real great when you're trying to move it again. So, um, walking frequently and at low intensity. I'm also not talking about going and walking, around your neighborhood or anything like that. We're just talking in your house, doing low intensity walking and then building on that, which your physical therapist will progress you there. Um, Another thing is, so we mentioned safety, we mentioned exercise, and then after that, it's going to be comfort. A lot of times after hip replacements, patients don't really feel comfortable lying in their bed, so sleeping in a recliner is fine. Whatever is comfortable for you after that. If your couch is more comfortable, then hit your couch. So safety is paramount, then exercise, and then comfort. If you need to, they usually will discharge you with ice machines or ice packs. So you can certainly use that to kind of help a little bit with any discomfort or pain that you might be having. But as I say, most patients don't have that too terribly often. You might have a little bit of it, don't get me wrong, but it's usually tolerated very well. So those are some of the things that you're going to be thinking about as far as how to successfully recover. Also, did want to mention, so with this type of surgery, you don't often, well, it's like 50-50. Sometimes those patients will discharge and go to outpatient physical therapy, but a lot of times they don't. A lot of times they may just have home health for 2 to 3 weeks, or maybe that home health physical therapist will decide to stay for the full 60 days that they can work with you within home health. But then after that, most of the time, patients really are, again, I shouldn't say most, but a lot of the time, patients will just um, do that, and then that's sufficient. They don't necessarily need outpatient. The patients that might want outpatient were, if you had a very, very active lifestyle, if you were very much into, working out and that type of thing, and then you had a hip replacement, you might want to go to outpatient for that just to push you to a higher functional level. But if you were just a typical retiree who's not doing, really strenuous activities, you're just kind of doing the, stuff around the house, taking trips maybe, but you're not, uh, cutting down trees or doing, really strenuous type of work around the yard or anything like that, then you probably will be sufficient to recover from a hip replacement by just um, doing your home health physical therapy and then progressing from there. As I say, doing walking for these types of surgeries, walking will get you far. So, anyway, um, I hope that this video has been educational for you. I hope that your hip replacement is the surgery is going well, and that your recovery is going well. And we'll be saying prayers for you that that's the case. Um, do check out, if you do go to outpatient, I'll attach to this video a video I did on what to expect from your physical therapy evaluation when you first go into outpatient. So you'll want to check that out. You'll also want to hit the thumbs up button for us and give us a like. And if this content is stuff that is useful for you, I ask that you subscribe to the channel. All right, y'all have a good one. Bye.